Okay, so today I'm going to demonstrate how to prepare an intramuscular or IM injection from a multi-dose vial. And many of us are familiar with this when we've had our influenza vaccine would be a perfect example. So vials are usually, they can be single dose, but for the flu viral, for example, influenza vaccine, it's a multi-dose vial. So they can get about 10 doses or more out of one bottle. Usually once this is open, it has to be labeled and there's a certain time frame in terms of how long it can be kept before it needs to be discarded as it's expired. And sometimes the medication, once it's been opened, also has to be refrigerated. But in this case, we're just going to show you how to do that. So before we start, I would have completed my hand hygiene. And again, I want to make sure I have a doctor's order and a medication record so that I can document once I've administered that. So in terms of this, it's the flu viral, and I'm going to be giving 1/2 ml of the dosage. So I'm going to remove my cap, and once we've removed the cap, this rubber stopper is sterile. Once it has been removed and we want to use it again, in order to use that medication again, we have to wipe the top of the vial on the rubber stopper. So we need to have a syringe, and I have a 1 ml syringe. I have my filter needle to drop, and I have my needle, which is usually a larger gauge, so it's in terms of diameter, it is not as big around. And for the influenza vaccine, we tend to give it into a small muscle like the deltoid muscle, so we use a shorter needle that's about 1 inch. So I'm going to open up my syringe and my needle and secure the hub of the needle to the top of the syringe. Then, because I had just removed the cap, this is still sterile, but if you are ever in doubt, you would take your alcohol swab and wipe the top of it. Okay? So now, because this is a closed system, I have to inject the same amount of air into the vial before I withdraw the medication. So I am going to withdraw 1/2 ml. So I'm first going to pull the plunger back on my syringe, remove my needle cap, and I am going to inject 1/2 ml of air. Then I'm going to turn my vial upside down, and I'm going to slowly withdraw that same amount of air. And it's always important to make sure the tip of the needle is beneath the level of the liquid. Sometimes if you remove it too quickly, you get a little bit of air, which is what I've actually done here. And I like to pull my plunger down a little bit further past the 1/2 ml. Then I'm going to remove my needle, pull the plunger down a bit, and make sure to knock out the air. Air will rise to the top, because we want to make sure when we eyeball it that we have exactly 1/2 ml of medication and not air. Then again, to make sure that we don't injure ourselves, this is the sharp, we're going to replace the cap simply like this, click it on, remove it, and then we're going to put our needle on that we will use for injection. Okay? And slowly prime the medication so that it's up into the hub of the needle at 0.5. And we're ready to inject.